Hello friends, today I'll tell you how to make a posteromedial portal in knee arthroscopy. So first visualize the notch. This is lateral condyle, this is medial condyle. This is the space between PCL and medial condyle. We'll pass through that space by holding knee in 40-45 degree of extension and pushing scope to pass posteriorly. It is posterior capsule visible. Now we'll palpate with the help of a finger and pass a needle to make a posteromedial portal. Now along this needle we'll pass a knife and make it incision to pass our cannula and dilator through that incision and make posteromedial portal for knee arthroscopy. So this is how we pass a blade or knife to make that incision in capsule through which we can pass a Visinger rod and through that Visinger rod or over that Visinger rod we can pass a dilator and over that dilator we can pass a cannula and like this dilator is passed and over this cannula is being passed. So cannula is passed till lateral border of medial condyle. Thanks for watching.